Recommended practices for newborn care specialists. The INA has worked to bring standards to the nanny industry for over 38 years. These are the recommended practices for newborn care specialists. Professionalism and continuing education. Participate in professional growth activities. The INA recommends that newborn care specialists become involved in social, cultural, and educational activities, not only to maintain and improve their newborn and infant child care skills, but also to enhance their personal growth and development. Suggested activities include attending newborn and infant development courses, seminars, and training programs on updated practices in the care of newborns and infants, participation in newborn and infant-related organizations, and involvement in community affairs and infant or newborn advocacy groups. Take steps to advance your career. The INA recommends that newborn care specialists consider taking the INA NCS Basic Skills Assessment and the INA NCS Credential Exam. Both assess an individual's knowledge of childcare and their understanding of the emotional, social, and physical development of newborns. Be honest about qualifications and certifications. The INA recommends that newborn care specialists provide accurate information about training and continuing education to parents and other professionals in the industry. It is suggested that any certificates, credentials, and certifications obtained be fully backed up with documentation. Insist on being paid legally. The INA recommends that newborn care specialists expect clients to offer legal and proper pay for all hours worked. This will vary by country and municipality. So, newborn care specialists should educate themselves on their rights and responsibilities within their own area. Act as an advocate for newborns and infants. The INA recommends that newborn care specialists be familiar with the signs of child abuse and neglect, and that they be knowledgeable in the procedures for reporting these signs. Newborn care specialists are court-mandated reporters and have a professional and ethical obligation to report suspected abuse of any child, infant, or newborn to the proper authorities. Newborn care specialists should actively promote the optimal development of any infant or newborn in their care. Grow your knowledge of how to successfully meet a child's physical and emotional needs. The INA recommends that newborn care specialists possess a solid knowledge of newborn and infant growth, development, and age-appropriate milestones, as well as research-based knowledge on formulas, breastfeeding, postpartum mood disorders and psychosis, brain development, sleep, illness, first aid, hygiene, preemies, multiples, and basic infant care. Keep detailed notes. The INA recommends that newborn care specialists keep detailed journals with details on care for the infant or baby, as well as other nursery duties such as, but not limited to, feedings and medications, infant or baby laundry, emptying nursery trash bin, sterilization of bottles and breast pump parts. Guidelines. Follow guidelines from governing bodies in the country of employment. The INA recommends that newborn care specialists follow the guidelines provided by the American Academy of Pediatrics or the respected pediatric resource or governing body in the country in which they are based, and to educate parents on these guidelines. Acknowledge that not all parents will agree with recommendations. The INA recommends that newborn care specialists acknowledge that parents may disagree with recommendations for the care of their children. In that event, it is recommended that both parties discuss these differences. If they are unable to resolve the disagreement, the newborn care specialist should either follow the parent's instructions, utilizing written instructions and a liability release, which states that the parents shall assume all responsibilities for the resulting decisions, or remove themselves from the position in a professional manner in accordance with their contract terms. Relationships with newborns and infants. Respect each baby as a unique individual. The INA recommends that newborn care specialists recognize that each newborn or infant in their care is a unique individual. Newborn care specialists are encouraged to create an environment that fosters each newborn's growth and development. Provide developmentally appropriate play and learning experiences. The INA recommends that newborn care specialists provide for the physical, emotional, intellectual, and social needs of the newborn or infants in their care by using the developmentally appropriate play and learning activities, materials, and equipment. Create and maintain a safe and healthy environment for children. The INA recommends that newborn care specialists promote the physical and emotional well-being of newborns and infants. Newborn care specialists are encouraged to partner with parents to create a safe environment for infants and newborns to play, learn, and explore. Relationships with parents. Respect the family's right to privacy. The INA recommends that the newborn care specialist show good judgment in maintaining confidentiality about the private lives of the families for whom they work. Provide non-judgmental support. The INA recommends that newborn care specialists remain neutral when providing information and resources and support the parents' decisions regarding their newborn in a supportive, non-judgmental fashion. The INA also recommends that if a newborn care specialist finds that he or she cannot do this, they assist the family if possible in finding a replacement caregiver who can provide the support the family needs. Require a written contract. The INA recommends newborn care specialists start every job with a descriptive written contract detailing all the conditions of the job, including information about the employee and employer, the time frame of the agreement and schedule, explanation of fees and costs, including deposits, NCS's duties and responsibilities. Some agreements will also include disclaimers or statements about the use of video cameras, use of vehicles, house rules, and confidentiality agreements. Remind parents of the nature of advice. The INA recommends that newborn care specialists remind all parents that advice given should not take the place of that of medical professionals, and that all changes to treatment should be discussed with a medical professional.